Hi, my name is Santo Jr. I'd like to start by acknowledging the Lenape people who are the traditional custodians of the land from which I'm presenting. Today I'm presenting on a systematic review and meta-analysis on the prevalence of specific mental disorders among people with opioid use disorder. Here are funding and disclosures of interest. So we know that mental disorders are common among people with opioid use disorder, and that mental disorders increase the risk of further morbidity, so physical health problems, as well as overdose and poor treatment outcomes. And so we wanted to estimate the prevalence of specific mental disorders, so depression, anxiety, PTSD, among people with opioid use disorders, and also look at factors that were associated with different levels of each disorder. We first searched Medline, Embase, and PsycInfo, and included any studies that had participants with OUD, and we included any study that had assessment of mental disorders according to DSM or ICD criteria. So we didn't include studies that just assessed mental disorders according to self-report. And for data analysis, we used random effects meta-analyses, and we looked at factors associated with variance, as I mentioned before. So variance in mental disorder prevalence by sex, recruitment setting, and age, and some other factors. In total, we included 345 studies and over 100,000 participants, and most studies included people in treatment. So they were recruited from settings that delivered OAT or from detoxification settings or hospitals, and most studies were from high-income countries and post-2010. So here are our results. We can see here the different prevalence rates for each mental disorder. In the red, we have the prevalence of mental disorders among people with opioid use disorder, and we can see that they far exceed the blue rates, which are those among the general population. For most disorders, we found that the prevalence was more than 10 times higher the general population estimates. So for example, depression, anxiety, PTSD, and we also found that factors associated with variance included higher rates of OCD, PTSD, depression, and anxiety among women with opioid use disorder. And we found higher rates of antisocial personality disorder and ADHD among men with opioid use disorder. So in conclusion, we confirmed that all mental disorders are common among people with opioid use disorder, and we provided specific rates which can assist service providers inform policy decisions related to treatment for people with opioid use disorder, and they can also guide future research related to mental disorders and opioid use disorder. For example, the need for more studies among people who are not in traditional OUD treatment settings like OT. And the barriers for treatment to mental disorder care are important to address among people with opioid use disorder, given the far higher rates of each specific mental disorder compared to the general population. And so providing maybe integrated care and removing silos between OUD treatment providers and mental disorder treatment providers is critical. And I'd like to acknowledge the participants, community, my supervisors and co-authors for this paper, as well as the researchers who provided additional data. Thank you.